My healthcare heroes are the nursing staff, PCTs, PCSs, and support departments at Crozier Chester Medical Center. Without these caring and dedicated professionals, our families, friends, and community would not receive the excellent care that they do each and every day at Crozier. In good times and hard times, these professionals continue to show up each and every day and put forth their best effort, and that is why they are my healthcare heroes.
You know, I was a new nurse and I started here and they welcomed me with open arms. Everyone was so nice from the beginning, and I've made lifelong friends here from that. My healthcare hero, personally, is my mom. She was here, she was a nurse manager here. Her whole career was at Crozier. She's the reason why I wanted to go into this career. So I'm doing this for her.
We like to nominate Debbie Moore. She's been up here in the OR since 1979. Unfortunately, she's retiring in November. But the reason that she's one of our heroes is because she's a wealth of knowledge. Whenever you need to know something or what doctors like or what, Debbie's the go-to. And on top of that, she's just a great nurse, caring about patients, on a heart team, just an amazing person. So we like to Debbie Moore. Thank you.
This is Ed Matulowicz being videotaped for 6ABC as a hometown hero. He's our hero.
All right, EMS here, one of the Union games, doing a standby. You can see, good times.
EMS on standby with the Philadelphia Union.
It's not all 911, it's not all fire and rescue. Sometimes we get to stand by with a Major League Soccer team.
Chris Kelly and Barbara Holfellner would like to recognize the Quality and Patient Safety Department for Heroes Month. Whether they were helping on the COVID units as buddies, monitoring exposures, manning the PPE room or command center, submitting data to the government, or just performing the regular awesome work, they are heroes in our book because they always put the patient and the safety of our staff first and continuously promotes excellence throughout the health system. Up, up, and away! Quality and Patient Safety Department. Thank you for all that you do every day.
These are my heroes. These are my heroes. They're the heroes and the champions of infection prevention. Every day, they look at those devices and they try to take them out and prevent harm to the patients. All of them, they're the best heroes in the world.
ICU, and our heroes are Suburban Pulmonary Medicine. Thank you for all your support and all you do for us.
We love you.
I love the DCMH directors here because it makes me feel like I'm a part of a team. Sometimes I feel like my position isn't as important as I think it is, but they ensure me every day that it is, and that I'm also one of their heroes along with them being one of my heroes. Go directors at DCMH. Yay!
My hero is Derek Margolis. Derek always goes above and beyond for everyone, and he always helps us out in a moment's notice.
I just wanted to nominate Pat McHale as the hero for Broomall Imaging and Delaware County Memorial Radiology. Pat and his team has come through many times for us, and we cannot thank him and his team enough for everything that they do for Broomall Imaging and Delaware County Radiology. Thanks, Pat.
Our healthcare heroes are everyone here at Taylor Hospital. Each and every single one of you plays an integral part in the patient care that we deliver every single day. You are all our healthcare heroes. Isn't that right, Newark? Speak for them. Good boy.
Good evening. My hero is Anthony, the transporter at Delaware County Hospital. I recently had the opportunity to get to know Anthony a little better because I filled in the PPE room during the months of April to July. In that time, I got to know Anthony a little bit better. I got to know the people that work every day with Anthony, and without a doubt, everyone said at that point, Anthony was a hero. So when you've asked for our opinions on who our heroes are, I thought I would let you know. Anthony is our hero. Anthony is the transporter who will do anything with a smile on his face and never complain about a thing. He happened to see a lot of scary things that most of us don't get to see. I work in the outpatient x-ray department, particularly the mammogram department. So Anthony is my hero because he does what needs to be done, and he does it with a smile on his face and a purpose in his heart.
And my hero is Donna Adams. She's always on time. She's always willing to stay late for the patients, and she loves her job. She loves the patients that she's caring for, and she's always very grateful when people go above and beyond for her. So she'll always give us something like a chocolate bar and a thank you note when we do something for her. Donna's always willing to do something for everyone else in the lab, and that's why Donna is my hero.
Hi, this is Dr. Kevin Caputo, the Chief Behavioral Officer of our system. I want to talk about my heroes today. My heroes are the people that I work with every day. The heroes in behavioral health are the people that take care of the underserved and the disenfranchised, and they are awesome to work with. So my heroes, in no particular order, are my team. So Dave Moran, who's feisty and spirited and very loyal. Dave is a hero of mine. Stacy Nawn, who is my Senior Administrative Director for Substance Abuse, is my hero. She's shown her true colors by being tough and handling a lot of crises recently. She's very reliable. She's awesome. Colleen Swayze is my Clinical Director of Outreach, and Colleen is stable, quiet, does her job well. She recruits a lot of people for us, and she always performs. Shannon Thompson Eldridge is my Senior Administrative Director for the Department of Psychiatry, and Shannon is one of the most organized people I know. She's a pleasure to work with, always professional. And lastly but not leastly is Joe Simpkins, who is my Senior Administrative Director in Mental Health, and Joe performs what seems like effortlessly, runs a huge service and is pleasant and always reliable and a great communicator. I love my team. That's what keeps me here. They are awesome and they're my heroes. Thank you.
And our healthcare heroes are the respiratory therapy department at Taylor.
Why?
Because they do such a great job. They come as soon as we call for them. They're team players and are always ready to help us.
Often dreamed of a far-off place where a hero's welcome would be waiting for me, where the crowds will cheer when they see my face, and a voice keeps saying, this is where I'm meant to be. I'll be there someday. I can go the distance.
These are my heroes.
We in the Materials Management Department are here every single day to keep our staff and our patients safe, and we continue during this pandemic to supply the organization, and you can see here of all of our supplies that we put out every single day to make sure that we are keeping everybody safe during this pandemic. We want to thank you very much, and everybody stay healthy.
Hey.
I wanted to recognize two Crozier Keystone heroes. One is Dr. Katie Beldowski from Geriatric Medicine. She's great with her patients. She's an awesome doctor. She takes her time. She's always concerned about them. The patients that are in the nursing home, she worries about what's going on with them during COVID. She was calling the families and doing FaceTime with them. She's an awesome doctor and an awesome person. The other person I wanted to recognize is Ms. Gwen Smith. Gwen, as you all know, is from the community. She's a big advocate of the community, especially Chester. She works day and night making sure that we do not forget those individuals. She helps with blood drives. She does flu shots, book bag drive. So she's an awesome person. She's an awesome nurse, and she's my other healthcare hero. Thank you.
If you're looking for heroes, you needn't look far. We've got them here. They're our superstars. In pre-admission, we do testing, always working, no time for resting. Wonder Woman got nothing on us. We've got a team that's superfluous. Linda, Francine, Mary, Audrey, and Sue always do their best to take care of you. They don't wear capes and they can't fly, but they have superpowers and that ain't no lie.
The schedulers. They are my everyday heroes. We can't run this hospital without staff, and they work tirelessly to cover each unit appropriately every shift and every day. They are my heroes. Thanks.
My heroes are all the employees at Delaware County Memorial Hospital. Thank you so much for everything that you have done and you continue to do every single day for our patients, their families, and our community. Thank you.
You're talking about heroes at Crozier Health during a public health crisis? Well, they're everywhere. They're at the bedside, they're in our parking lots testing our community, they're in home care, they're in our ambulances, the environmental services team, food services team. But for the past 7 months, I've been working side by side with a group of people who make up the Crozier Health's COVID-19 Command Center Task Force. This is a team of people who you would call unsung heroes. They work every day to organize the health system's response to this crisis. They establish policies and protocols, they maintain regulatory readiness, they keep our workplace safe, our workforce safe, they roll out projects and programs and communicate new information, they organize data, and they've become the go-to contacts for everyone who needs COVID-related support. So it's been my privilege to work with Kevin, Angie, Emily, Quan, Deb and Salima, and our two leaders, Conlon and Dr. Zimmer. So this one goes out to all of the unsung heroes at Crozier Health.
Hello. Like never before, the world sees how much nurses do to make a difference. I'd like to recognize my coworkers, Valerie Pittman, Amanda Heider, and Lakia Cord. You make the world a brighter place. Thank you.
Hi everyone. Welcome to One North, home of the COVID heroes.
Hey! That's right, we're here to take care of you if you have COVID-19, and we do a really good job.
Here are my heroes, every one of you, particularly under these circumstances that have been ridiculously trying for all of us. The housekeepers, the transporters, the dietary folks, the people at the bedside, nurses, therapists, technicians, you name it. Those of you who do get that opportunity to work at the bedside. How about the rest of us who don't get that joy that comes from being near patients? Many of you have sacrificed as well, and so have your families. You're all my heroes. God bless you. Thank you for what you do.
Stay strong.